Today I aim to connect the scientific understanding of pain, race, and helping with the problems that we are currently facing in terms of police brutality and violence against Black people. Essentially, one thing that we need to start with is knowing that, in general, white people are failing to help Black people in need. And this talk aims to figure out why. In order to understand the failure of white Americans to help Black Americans, we should look at racial stereotypes of pain. And we have to go to the past to examine these. And these stereotypes suggest that Black people experience less pain than white people. These stereotypes originated in the past, in colonialism and in slavery, and I believe these stereotypes fostered the dehumanization that was necessary to engage in the racial sociopathy of slavery and colonialism, as it made Black people less than human in one's mind. It also justifies the system of white supremacy by suggesting that Black people were naturally inclined to experience hardship. Thus, when you look at this stereotype, it provides a justification for white supremacy. These stereotypes are not some relic of the past. People still believe them. If I asked you to picture who believes that Black people experience less pain than white people, do you think you would see a well-educated white medical student at an exclusive medical college or university in your mind's eye? Well, you should. Over half of medical students surveyed who have passed numerous tests on medicine, on biology, on the relationship between these factors and the human body, believed awful ideas like Black people have less nerve endings and thicker skin. How can a highly educated member of our society believe these pain stereotypes? But better yet, when we consider the numbers, that 87% of physicians in our nation are white, when only 76% of the population is, and only 6% of physicians are Black when 13% of the population is. I think the real question is not how do they have these beliefs. The real question is what are the consequences for Black patients. Now, the story is actually more complicated than I presented in the previous slides. Specifically, controlled laboratory experiments consistently find that healthy Black individuals experience pain more intensely than healthy white individuals. This may seem a bit contradictory to my previous statements. However, we must now begin to think about how racism impacts the experience of pain and the physiological pain system. Why do healthy Black people experience more pain than healthy white people? This is actually a question that we don't have a direct answer to. However, some evidence suggests that experiencing racism and the stress of racism increases the experience of everyday pain like back pain. However, I like to look at racism for what it is, an extreme form of social exclusion. Black people are excluded from jobs, are excluded from opportunity, are excluded from healthcare, excluded from life in the case of police murder of Black people. The exclusion of Black people in American society is intense. And what do we know about social exclusion? Social exclusion directly impacts the pain response and the physiology associated with pain. Now let's go back to my question. What happens when white physicians who believe that Black people experience less intense pain than white physicians treat Black patients? Well, the results are Black people receive worse pain treatment. This has been found in hospital records and controlled experiments for things as clear cut has long bone fractures. Meta-analysis bear out this effect. What we know is that Black patients receive worse pain treatment. And we also know that these thoughts, these stereotypes, these beliefs about Black pain lead to worse quality pain treatment as well. Now, we may think this only exists in medicine. However, if we look at the evidence, Black people experience oppression, extreme amounts of pain in medical treatment, in education, in policing, in sentencing, the justice system, in businesses, in loans, in nearly every aspect of American life that matters. And what we also know is that controlled laboratory experiments show that white people help Black people less. White people, despite witnessing this oppression, despite causing this oppression, continue to not help Black people. This is a major finding. If we look at the failure of physicians, it's a failure of helping. If we look at the failures of police, isn't that also a failure of helping? If we ever end to overturn the system of white supremacy, we have to start understanding why white people continue to not believe, not observe, not process, and not respond to or help Black pain. We don't know why this exists for certain. However, there are some potential explanations from psychology. The first is what we know as the other race effect, which is for white people, Black emotion is not recognized as easily, as readily as white emotion is. We also know that this effect is moderated by segregation. Those individuals that live in an unsegregated, multiracial environment are less likely to show the other race effect. We also know that in American society, we live in racially segregated communities. This is a map of Baltimore. The blue dots represent the Black population. The green dots represent the white population. What you can see in Baltimore is a very segregated society. When we look at New York, we can see that the segregation clearly exists between the white and Black groups, the blue and green dots. However, the Latinx groups are segregated, Asian groups are segregated as well. We can see the segregation in New York City. In San Francisco, we can see the segregation as well. If you look at some of the adjacent communities like Sausalito, which is a all-white community, or parts of Oakland that are predominantly Black, we can see that the segregation exists in our communities, that we are not living in integrated environments. If we look at Chicago, we can clearly see the segregation as well. If we look in fact, every major city, we can see the segregation. We are living in segregated environments that in some way likely foster a lack of response to one's pain. Why do white people continue to not believe, not observe, not process, not respond to Black pain? The thing we have to go back to is helping. What's the best predictor of helping? It's empathy, according to much research in the field of psychology. What predicts harm? Dehumanization. And when we look at the minds of white people, we find that cognitively, Black people are more associated with animals in the minds of white people than white people are. There is something about living in American society that is leading to the dehumanization of Black people. And it's going to lead to harm, and it's going to lead to a lack of helping if we trust the literature. Now, I am arguing today that these processes likely impact police behavior. Now, there's no direct evidence to support this, but we do know that when people have contact with the police, and the people are Black, they are disrespected. Now, people do call the police for help. And when Black people reach out for that help, what are they likely to receive? Disrespect. We also know that police are more violent with Black kids in schools than they are with white kids. So it appears that white kids are allowed to make these mistakes of maturity, but Black kids will go to jail for something as simple as maybe a little scuffle in the hallway. Maybe a statement said off the cuff, right? This appears to me to be a lack of empathy, a lack of helping. And when we look at the composition of police forces, we notice an overrepresentation of white officers. This graph represents that overrepresentation. On the bottom, you have the share of the white population. That's the x-axis. On the y or vertical axis, you have the share of white police. The one thing I want to point out is that the number of dots above the line represent overrepresentations of white police officers in the community. That is, there's more white police officers in the police force than there are white people in the community. And what we notice, there are only a couple dots that are underneath that line. A majority of those dots are above that line, and some are drastically above that line. White police forces are patrolling people of color. That's what we see in this slide. Why does this matter? We only have to look at one set of data. The set of data that shows race, one's race and dying at the hands of the police. Now I'm showing the whole graph here, but on the right I've pulled out the white and black data. Now what you can see is that black men between the ages of 20 and 40 are much more likely to die at the hands of the police than white men between the ages of 20 and 40. In fact, when you do the math, it's nearly 3 times higher. In fact, I pulled out those two graphs and put them right next to each other so you could see how drastic that effect is. Would that happen if our police forces represented the people that were being policed? Based on the research in psychology, I would suggest no. And there is evidence for this suggestion. We know that when police forces are more diverse and serving a diverse community, the arrest rates goes down, the violence goes down, the murder goes down. In this quick teach-in, I've presented evidence that the pain of Black Americans is discounted by white Americans, that despite experiencing more pain and more oppression, Black Americans are less likely to receive help in general and are less likely to receive help from their physicians and are less likely to receive help from the police. The cost of racism is pain. The cost of racism is also not receiving help. This is inhumane and must stop. Black lives matter. Black pain matters.